Namaskar and a very warm welcome to Question Hour. I'm Nidhi Kumar and you're watching India Science. Since the launch of the new vaccine program on June 21st, the nation has witnessed 14,81,583 jabs in just a matter of days on July 4th. In this phone-in program where you can ask your questions, we take your queries live. So today we are joined by the very eminent Dr. Vineet Talwar, Director, Department of Medical Oncology, Rajeev Gandhi Cancer Institute, Delhi. Many thanks for joining us today. We are indeed honored, sir. Thank you. Namaste.
Thank you, madam, and good afternoon to you.
Yes. Good afternoon to all the viewers also. My first question to you, sir, is India ready for the third wave? If you could tell us and explain the Delta Plus variant, K417N.
Well, what happens is that this virus keeps on changing its form. It keeps on mutating. When you say mutating, means that it keeps on changing from one form to the other so that it catches the body off guard. When that happens, then the vaccines which you give, they are targeted to a specific form of the virus. So you can have the alpha form, you can have the beta form, you can have the delta form, you can have the delta plus form. The one which we had in the second wave, unfortunately, was the delta form. And that led to most of the problems which were associated. And now it has been postulated that a delta variant that is going to come into vogue. And this delta plus variant is again another mutated form of the original delta form which we had in the second wave. As most of the patients, that is 80% of the patients in India, had come under the purview of that delta variant. So the question now would be that the vaccine which we are going to target, is it going to be fully effective against this Delta variant or not? That is the big question.
Absolutely. And on that note, we're joined by our first caller, Suvreen Mishra, joining us from Mumbai. Namaste, Suvreen. Welcome to India Science. Please ask your question.
Namaste, ma'am. Hello, sir. Sir, my question is, Health Ministry has now allowed pregnant women to get vaccinated. Pregnant women can now register on the, CoWIN platform. So how do you see this? Do you think the vaccines are safe for them because pregnant women are not allowed to get any kind of drug? I mean, what do you have to say about this, sir?
See, as far as the vaccine is concerned, the label the vaccine has got is for emergency use. That is not only for pregnant women or children or the people at large. The emergency label implies that if you give the vaccine, then it is going to be beneficial. Now, in the studies which have been done, there have been no studies in which specifically the pregnant women have been targeted and seen how they fare, what are the side effects. Suffice to say that in a subset analysis, the ladies who are pregnant and they have been given vaccine, it has been found that definitely they are beneficial in terms of the control of the virus scourge.
I hope that answers your question, Suvreen. Thank you for joining us. We're now joined by Shikha from Surat. Namaste, Shikha. Welcome to India Science. Please ask your question.
Hello, ma'am. Hello, sir. This is Shikha. Sir, my question is, as the lockdown is open, so how can we resolve overcrowding as third wave is also coming?
How can you resolve the crowding?
Overcrowding.
Because, Shikha, thing is that there are two issues to it. One is what you expect from the government, and second is what you expect from yourself. The government can make a conducive environment. They can provide the vaccines. They can give you all the kinds of guidelines which are possible, like wearing masks, like hand washing, and what are the basic and the numerous ways of doing social distancing. Now, it is up to us as the citizens of India that no doubt the government is helping us in a big way. It is our moral responsibility and our moral duty also to make sure that we follow these rules, which unfortunately is not the case as of now, as the last week Lakshmi Nagar market, which was forcibly closed down because of the blatant violation of the social distancing norms. So I feel that if the government has a onus in preventing us from getting this pandemic, our endeavor should be to try to pitch in and try to do our bit. And if somebody is not following these simple norms, there is no high tech thing about washing hands, about wearing mask, about keeping distance of about 1 or 2 meters. There is nothing high tech about it. So if somebody is not doing it and you try to educate that person, I think bulk of the job is done. So we do it, the government does it, then it is a win-win situation. If the government does it and we don't do it, well, you are just stuck at the 50% mark. That is the whole problem.
Absolutely, and I hope that answers your question, Shikha. With this, it also shows light that the government is now doing color coding, like we've seen. You explained Lakshmi Nagar, Malviya Nagar, all these places are being color coded to see overcrowding. We're joined by another caller, Harsh Mathur from Kolkata. Welcome, Harsh.
No, ma'am. Hello, sir. My question is, sir, how does COVID vaccine work?
Okay, so this is a basic question. What happens is that the virus, it has certain particles on it. For example, this COVID virus, it has a protein which is known as a spike protein. So whenever this gets into the body, this protein generates a response from the body, which are known as the antibodies. That is anti-virus protein, that is anti-spike protein. So when you give this vaccine, now vaccines are two types. One is the Pfizer or the Moderna type, in which you are injecting a part of the RNA, that is part of the virus you are injecting inside, and hoping that the human body starts building antibodies to these particles and then generate a response, because whenever later the infection is going to occur, the same antibodies are going to work against the virus and try to shed it out of the body. The other way is that you get the whole virus of some other kind, you make it incapacitated, and you inject in the body. Again, the principle is same, that the antibodies will be generated by the body against that vaccine, with the hope that later on, when the virus infection occurs, the body will be able to repel it effectively. So whichever the vaccine it might be, the basic principle is you inject a part of the virus or the whole virus which is attenuated, so that the body's response systems and the guards of the body, they are activated for an infection which might occur at a later point of time, and the body is ready to tackle it and push it out of the system instead of getting infected by it.
Uh, I, Meanwhile, thank you, Harsh, and we have Rashi from Chhattisgarh. Please ask your question, Rashi. Welcome to India Science. Welcome to India Science, Rashi. Please ask your question. Are you there? I think there's a lag, sir. Meanwhile, I'd like to ask you a question that is flashing on the YouTube. What are the
Sure.
precautions, sir? What are the precautions that cancer patients should take during this time, especially if they are undergoing chemotherapy?
This, with respect to the pandemic which is going on, It is a very important question. Cancer patients have been labeled as the vulnerable category as far as the pandemic is concerned, meaning thereby, if possible, as soon as possible, all these patients should come under the purview of vaccine. Barring certain situations like if the patient is post-transplant or post-monoclonal antibody injections like rituximab, if it is not the case and the patient is in good general condition and performance status, say about a couple of weeks post-chemotherapy, then these patients are ideal to have the vaccine because they are going to be the most beneficial. And when they go back home, they are going to create an increased immunity situation at home so that the caregivers at home are also benefited. So, one point is getting them vaccinated as soon as possible. The other thing is, of course, the measures like wearing a mask, washing hands, social distancing should keep on being continued. And third thing is that they should indulge in those activities which are most necessary only. Like, for example, if they have to go out of the house or they have to interact with a lot of people in congested situations, all these should be avoided. So the
Absolutely.
standard precautions plus vaccine, I think that is the
Works.
mantra.
Absolutely. We're joined by Rashi from Chhattisgarh. Welcome to India Science. Please ask your question.
Good afternoon, sir. Sir, I
Yeah,
just
good afternoon.
recovered. I have a question. Sir, I just recovered from COVID-19. I have been told not to engage in intense exercise for a few months. What is the reason behind this?
So, Rashi, you tell me first, what all symptoms did you have during COVID,
Uh, that
during the
might be.
infection?
Yeah, actually, I have suffering from somehow fever and throat. I have literally have no body ache and soreness about. So I've been no have to above from that. See what is the reason behind that? I should
Did you have
pass.
any problems in the chest? Did the chest X-ray or the
No,
CT
no
scan
sir,
show any problems in the chest?
no sir, no sir, no sir. Not that major
Okay.
part, but yeah,
Oh,
have
see,
little symptoms of that.
the basic issue is that, like any other viral infection, uh, the body requires some time to recuperate. And we want that all the energies in the body, everything should be focused on recuperation. We don't want, the energies to be channelized in any other fashion, like doing strenuous exercises or like doing aerobics or workouts. Fortunately, as I can imagine in your case, you did not have any problems in the chest. Especially once you have those kind of problems, when you have pneumonia because of COVID, it is mandatory to rest so that the lungs can get back to the normal self. And this requires, a kind of a rest over weeks. It is not in days. So you
Okay.
channelize all your energies to get the body recuperated to its best. And for that, probably there is a blanket thought that you don't indulge in strenuous activities. Probably 3 to 4 weeks down the lane, if everything is fine, then you can indulge in the normal daily chores which you used to do earlier.
Yes, sir. We have another question on YouTube. They're asking, what are the precautions that a normal person should take after being vaccinated? If you could, elaborate on that.
Well, there is nothing much which the person has to take after vaccination. In a percentage of patients, patient might have constitutional complaints. When I say constitutional complaints, person might have lethargy, malaise, body aches, and in some cases, fever might be there. But Generally, these are lasting for about 24 to 48 hours in the large population. So what one can do is, if these things are there, then probably they can pop in a tablet of paracetamol morning, evening for about
Absolutely. And we're getting some more queries on influx of cancer patients. If you could elaborate how that is going on in your hospitals, since now OPDs have also started. Are you seeing a more vaster influx now?
Yes,
We
madam.
have another
Please
question,
tell me.
sir. Uh, Sir, what are the
yeah.
side effects that cancer patients face post vaccinations? This has come on our YouTube right now.
Yeah, this is again a very
Important
important
question.
question.
Right,
The
sir.
cancer patients, unlike the normal patients, are slightly immunoperatic. The immunocompetence of the cancer patients is slightly less as compared to the general population. So when you give them these vaccines, then probably the side effects which is seen in the normal population may be exacerbated or exaggerated in these situations. Nevertheless, in a very, very small percentage of patients, you might have situations where you have problems related to thrombosis or you have problems related to myocarditis. But generally, it is limited to only the bony pains, lethargy, malaise, low temperature, or flu-like syndrome, which can be there for about 48 to 72 hours, after which generally most of these symptoms abate when you take tablets like paracetamol or any other painkillers. And the other thing is that the duration when the vaccine should be given, that is very important. For example, if a patient has been given chemotherapy today, the ideal duration after which the vaccine should be done is about 2 weeks, so that the patient is able to shed out the side effects of chemotherapy, which are generally around the 8th or the 10th day, and by about 14th day, that is 2 weeks, the patient is relatively fit to take the vaccine. So one is you have to ensure the timing of the vaccine, which is very important. And definitely, once the vaccine is given, the side effects are almost similar as to a normal individual who takes vaccine.
Absolutely, sir. Thank you for sharing these insights. We are joined by yet another caller, Mr. Banerjee from Kolkata. Namaste, welcome to India Science. Please ask your question.
Namaste, ma'am. Namaste, sir. So my question is, sir, when to do chemotherapy post or before vaccination?
When to do chemotherapy
Post.
post. I told you, no, the ideal time of giving vaccination is 2 weeks post chemotherapy. Or if you envisage that the chemotherapy has to be given later on, then it should be 2 weeks prior. So 14 days gap is ideal. If perchance you cannot give that gap, and if the patient is fit physically and the blood indices, that is the complete blood count, the liver function tests, and the kidney function tests are normal, then also the patient can take the vaccine. But generally, if possible, you give a 2 weeks gap.
Absolutely. Thank you for sharing this again, because callers are continuously joining us. Another question that we have on our YouTube right now is that the government says, you just mentioned timing. So the government says 2 weeks to 4 weeks, but in case of patients who we are addressing today, patients with cancer problems or onco-related issues, the gap you said is 2 weeks.
Yeah, 2 weeks should be the minimum gap,
Right, sir.
after which you can give these.
Absolutely. Uh, we're joined by Ms. Khanna, Shivani Khanna from Meerut joining us. Namaste. Please ask your question, Shivani.
Namaste, ma'am. Sir, I have a question. Sir, what is the precautions to take in cancer patients for vaccination?
See, there are no particular precautions which you take for cancer patients. The patients where transplant is undergoing, or the patients who have specific monoclonal antibodies like rituximab, in those patients you have to have a gap of about 3 months before you can vaccinate them. The others, it is, as I had just mentioned earlier, it is 2 weeks post chemotherapy. Now, when that is the situation, then at that point of time, the complete blood count, the kidney function tests, and the liver function tests can be done to ascertain whether these patients are physically fit for the vaccine or not. If there's any problem in that, probably another week it can be deferred. And of course, they should be in good hydration, good nutrition, and you make sure that there are no other incumbent problems like fever or any other infection which is there prior to the vaccination. Otherwise, it is the same as any regular individual getting the vaccination.
Thank you, sir. We're joined by another caller. Jagriti is joining us on India Science. Welcome, Jagriti. She's joining us from Gujarat. Please ask your question.
Hello, ma'am. Hello, sir. This is Jagriti. My question is, sir, can vaccinated people still spread virus? And so, when can we achieve herd immunity?
Well, this is another interesting question which is often asked, that vaccinated people, can they spread the virus? The answer is no, they don't spread the virus. But the flip side is, can vaccinated people get COVID infection? Answer is, in a small percentage, yes. But then when they get COVID, then the degree of the intensity of the infection and the symptoms are much, much less in a vaccinated individual vis-a-vis a person who is not vaccinated. Now, coming to herd immunity, as you have seen in Israel, where almost 60 to 65 percent of the population has been immunized, then that itself, causes a challenge to the virus to spread around. Because if more people are vaccinated around you, then the virus has to infect in a very, very robust way to cause the infection. Because those people who are vaccinated around you, they have an antibody titer which is there in the body, which can overwhelm the virus. So the virus has to work harder. And at the same time, it has to work harder and it infects lesser people. So the mantra again is to vaccinate, vaccinate, and vaccinate.
We're joined by another caller, sir.
The more antibodies they have.
Yes, thank you so much. We're joined by Akansha now. Namaste, welcome to India Science. Akansha is joining us from Kanpur. Akansha, please ask your question.
Hello, sir. My question is, I'm just curious to know, if someone is undergoing chemotherapy, is the timing or gap between doses of vaccine a factor? Is there something like that that should be kept in mind?
See,
Yeah.
if you're in India, you are getting Covishield or Covaxin. In these, initially the gap used to give the vaccine on day one, and then it used to be given after 4 to 6 weeks. But now it has been, elongated to 3 months. There is data to suggest that if you elongate it further, or if you increase the time in between to say about 8 months or 9 months, the efficacy increases further. So having said that, the average time between the first and the second dose is 3 months. If you are taking chemotherapy, then as I had mentioned earlier in the previous question, the gap should be about 2 weeks minimum. If you have completed your chemotherapy, then probably if you have taken the first dose now, you can repeat it after 3 months. That is the standard schedule.
Thank you, sir. I hope that answers your question, Akansha. Sir, another question flashing on our YouTube is, What about cancer patients taking monoclonal cocktails? Are they effective? And what is the difference between a monoclonal cocktail and plasma therapy, if any?
This monoclonal cocktail, that is the Cipla
Yes,
cocktail, which is
yes,
there,
Cipla.
these are the neutralizing antibodies. They are taken in those conditions in which you anticipate that the patient is going to have a worsening of the situation. So the earlier the taken, the better it is. But then the general convention is that you tend to check the antibody titer. That is not of much benefit in these situations. So if you are taking the antibody cocktail, that is the neutralizing antibodies, they have to be given in a window period. That is, the earlier the better. Whenever you contact and you have the infection and symptoms like fever, before getting the chest symptoms, the sooner you give the injection, that is the best way. And the plasma therapy now that is being pushed to the background. Initially, it was much in vogue, but now it is only for very, very niche situations, specific situations, and it is not given generally as a part of the treatment. So, neutralizing bodies, antibodies, yes. Plasma therapy, as of now, it is no.
Thank you so much, sir. We're joined by yet another caller, Anurag from Noida. Namaste, Anurag. Please ask your question.
Sir, do cancer patients face the prospect of a comparatively safe of COVID? What can do to minimize it?
I think your voice is breaking.
A little
I
breaking,
cannot
yes.
make out the question. If you can, madam, you can tell it to me.
What are the... Can you please repeat, Anurag?
Patients
I
face
think there
the
was some.
prospect of a
Yeah.
comparatively safer bout of COVID. What can they do to minimize the risk?
To minimize the risk for cancer patients, sir, is his question. He has somebody at home who's suffering with cancer. So he's saying, what
Okay.
can we do to minimize the risk other than, can this monoclonal cocktail be taken before somebody gets COVID is his basic question.
No, no,
Oh,
no,
yes,
no.
yes,
Answer is a big no.
yes.
Only when you are sure that you have been infected. Because see, it is as simple as that. If you have a lock, then only you can put the key. If you have been infected, then only you give these antibodies. If you have not been infected, just on a presumption, if you give, then you do not expect the desired results. So I think it's a big no. You should not. You should not jump the gun. And at the same time, keep on following the natural processes like distancing, you washing your hands, wearing masks whenever you're going out. I think that should suffice. There should not be a fear psychosis in the mind that just because the person is suffering from cancer, he or she is totally immunoparalyzed. It is not like that.
And on that note, I'd like to thank you, doctor. As I thank you, I can still see a lot of questions coming up about the worldview on cancer patients suffering from, these kind of oncology problems in Russia, and why is the third wave not wrapping up in UK. But I'm afraid, viewers, we are running out of time, and for this paucity, I apologize. And with this is a wrap-up of our phone-in live session. Do join us next week at the same time. I would like to thank you, Dr. Vineet Talwar, for joining us. And let us together write India's success story in crushing the pandemic. We are seeing slowly the numbers go down. And as always, I can say thank you very much. And as doctor said, vaccinate, vaccinate, go get that jab. On that note, namaskar. Many thanks for watching.